All right, let's bring in our panel to discuss. Joining me now is Dr. Ashish Jha, director of the Harvard Global Health Institute. Seth Denson, healthcare analyst. Good to see both of you. He's also the author of The Cure, a blueprint for solving America's healthcare crisis. Doctor, I'm going to start with you. We just played Governor Cuomo there talking about the medical supply chain issues. How important are these antibody testings, and how do states build a bridge between them and federal government to make sure they have all the supplies they need?
Yeah, so good morning, and thanks for having me on. So those antibody tests are pretty important. They're going to tell us a lot about how widespread the infection has actually been. They might be able to tell us who's really immune and who's not. We just don't have the signs on that yet. But the idea that all 50 states are going to sort of compete with each other for those reagents and vials and tubes that Governor Cuomo brought up, I don't think that's exactly the strategy we want. So we do want a kind of coordinated federal strategy, with states, of course, taking a very important role, but it's got to be a single, united effort across the country.
And Governor Cuomo is scheduled to meet with the president later today. Perhaps we'll have more answers on that as well. Seth, during yesterday's White House task force briefing, President Trump said that 50 to 60,000 people in the U.S., they're expected to die from the coronavirus. Any number is horrible, but it is far less than earlier projections of maybe 2 million. What do you think led to this? Are we doing the right thing here in social distancing? Is that what made the projections fall, or were these projections built in with social distancing already in them?
Well, no, I think that the original projections were based on life as it normally would be. And I think that there's no question that the social distancing is having an impact on not only the spread of coronavirus, but the spread of other things. I mean, the flu season is practically over as well. And so there's no question that the social distancing is working. It's being part of it. But listen, we will never know how vast this could have been had we not taken the proper precautions. And I think that's one thing that pundits like to talk about, is how bad it could or couldn't have been.
Yeah, good point. Back to you, Doctor, really quick. Another thing you hear a lot from pundits and others, even the media, mainstream media, saying we need more testing. But there's a lot of flaws with testing. You can get false positives. You can get false negatives. I'm just curious here. It's still early stages of, is our testing even accurate enough to say something like that?
Yeah, so great point. There are two types of testing that people should know about. There's the antibody testing we were talking about earlier. There is a lot of false positives and a lot of false negatives. There are similar problems with that testing for the virus, but in general, we think that's a better test, more reliable test, and we need to be doing both. So I think it's going to be very hard to open our economy and keep our economy open if we're not doing active lots and lots and lots of testing for the virus. For the simple reason that if you go out to a coffee shop, you want to know the guy sitting next to you is not infected. And the only way you're going to know is if people are getting tested all the time. So we really do need a lot more testing if people are going to feel safe to go about their lives again.
Another thing to feel safe, you want to ease these fears that we could beat it and then we're done. But we hear from the World Health Organization saying the worst is yet to come for the outbreak. Seth, do we think we're going to see another second wave of this?
I think most experts predict that the coronavirus will reappear, whether that be in the fall or sooner, or when we all go back. I think the benefit that we have now, and some are comparing this to the Spanish flu, which medicine has advanced greatly since the Spanish flu, but also herd immunity, vaccines, and as the doctor just mentioned, testing. All three of those things work in conjunction to make sure that we beat this long term.
Last response, Doctor, I'll give that to you, please.
Yeah, so there is no doubt about it, we're not done with this virus. This is the first wave. We can't be done, right? Because the virus is going to be in our community and most people will not have been infected. So it's going to be with us for 12 to 18 months until we have a vaccine. But as Seth said, if we are smart, we do some smart policies, do testing, keep some amount of social distancing in place, I do think we can get through this without a lot more people dying.
Dr. Ashish Jha, director of the Harvard Global Health Institute, Seth Denson, healthcare analyst. Guys, thanks so much for joining us. Stay safe.